Good morning, everyone. This is Dr. Nicole Monteiro with the Center for Healing and Development, CHAD. And thank you so much for joining this morning for this topic that I want to talk about in the weekly Mental Health Moment with Dr. Monteiro series is therapy, what you need to know before you start or go to therapy. And so we're hearing more and more these days about mental health awareness, about trying to break down the barriers to mental health treatment, to erase some of the stigma that particularly is prominent in a lot of cultures, and encouraging people to go to therapy. You hear a lot of big name people. You hear Jay-Z, you hear Taraji Henson, you hear Mariah Carey saying she has bipolar. You hear so many people now talking about going to therapy. I just saw an article yesterday where the rapper and actor and activist Common talked about in his memoir that he had a repressed memory that came up that he had been molested by a family friend when he was a young boy. And he talked about how, that made him feel. And he mentioned talking about it with his therapist in therapy. So in many ways, in certain circles, going to therapy is becoming more and more normalized. People are talking about it. It's not that people didn't go to therapy before. I've had my practice for years, and I've seen all kinds of people, men, women, Black, white, Asian, Latino, immigrants, refugees, all kinds of people. But now people are speaking up more about it, and which is a great thing. And it's making more and more people curious about what this process of therapy is about. And so some people are still confused. They're trying to figure out, hey, it sounds like it might be a good thing. I want to get on the bandwagon. I want to try it out, but I'm not sure where to start. So I wanted to talk about a few things that you need to know before you start therapy. And number one is to know that you are taking a huge step. You are making a significant and important investment in your own wellness, your own well-being, your own healing, your own overall health. And so this is not to be taken lightly. You need to congratulate yourself, commend yourself, but also understand that you are embarking on a journey. And this is a huge step that you're taking, going to therapy, getting some kind of counseling, trying to work on things that might seem like in the moment it's easier to bury, but you realize now that these are things that you can no longer keep silent about, that you can no longer push down or repress or suppress or just try to get through and get over it without some additional help, some professional help. Maybe you've tried it on your own, and you've gotten, to a certain point, but you want to go a little bit farther. Maybe you've talked to friends and that's been helpful, but you're looking for more. Maybe you've gone to other support systems in your community, whether it's religious or social or whatever, but you are just looking for something else, a professional who can help you through it, someone who might have skills that you didn't have yourself to work through this, or other people around you didn't have, or an objective, neutral standpoint or approach. And so you are taking a huge, huge step. And this is very important. And it's important to remember that because there will be parts of this journey that are difficult. Like I said, you've buried it for so long, you haven't talked about it for so long. And so bringing it up might be come with some sense of difficulty and not feeling so good all the time. So you are taking a huge step. That's the number one thing that is important to know. Number two, the important thing to know or think about is that you should do some of your own homework, right? So if you do anything important in life, whether it's going on a trip or starting a new job or looking for a specialist, another medical specialist to treat a condition, what do? You do some of your homework. You do your own research. First of all, you want to know, what does this process entail? Maybe you want to ask some people around you who've already done it. And thank you all for joining. You want to ask people around you who've already done it. You might want to, we're in the age of technology where we have the internet, so you can look up so much information about this. So you want to do your homework, and doing your homework could mean a number of different things, a few of which I just mentioned. You can talk to people who've been in therapy before, and you can ask whether it's for a referral, for someone that maybe what the therapist they went to, or if their therapist can recommend somebody. You want to ask what the process was like. It's kind of mystical, right? We see it portrayed in some movies. We don't know if you're just there lying on the couch. You don't know if you're talking, if the therapist is talking to you. So trying to get a sense for any person that you talk to who's been in therapy, what it was like for them. And then you want to start looking for people who might be potential therapists that you might want to have a consultation with. And how do you do this? We usually say that the best way to go about finding somebody that's right for you is to ask for a referral, right? So like I said, you can ask a trusted friend, you can ask a family member. If you don't know anybody who's in therapy, you can ask your primary care physician. If you are using insurance, you can go to your insurance company and look up the profiles of therapists that are in network, that are in your area, and you can see what their specialties are. You can search the web if you have a really specific problem. I once treated a young woman that had trichotillomania, which is like picking out the hair. It's sort of an impulse control issue that under stress and anxiety, you pull out your hair, whether it's on your head or your eyebrows, eyelashes, and so forth. So you can look up the issue that you're dealing with. I know now a lot of people are talking about trauma. And so you might look up trauma therapists. You can Google it. So you can ask around, you can use word of mouth, you can use your physician or other medical professional. A lot of times as therapists, we network with medical offices so that they know where we are, the kind of work we do, the kind of cases we work on. You can ask even at your local school. I know I tell the local schools and communities about my practice and the work that I do, right? You can ask, you can look at your insurance company and you can Google it, right? But you want to start doing a little bit of homework about what the process might be like, as well as who you might want to get referred to. And then once you sort of gotten some names or started to narrow it down or think about a clinic or a practice or a therapist that you might want to go to, when you set up a time, a consultation, whether you can speak to them by phone or communicate with them via email, you want to just, again, continue to do your own research and homework to find out what kind of mental health professional this is. So there are all kinds of professionals. We have psychologists. I am a licensed psychologist trained as a clinical psychologist. There are social workers, licensed clinical social workers or licensed social workers, mental health counselors, and depending on the state, it might be called a licensed professional counselor, a licensed mental health counselor, a mental health counselor. And then you also have psychiatrists who are physicians, medical doctors, physicians with a specialty in psychiatry, and that is the one professional in the mental health field that can prescribe medications. They all have sort of a different focus. Psychologists go through extensive training in therapy and other aspects of mental health treatment, as well as our expertise includes psychological testing, assessment, and evaluation. So we use scientific and other methods sometimes to help with diagnosis, treatment planning, and other aspects of evaluating what the person's problem is. So you want to first find out, or one of the things you want to know is, what is this person's specialty, right? What is their field? Are they a psychologist, a counselor, a social worker, or a psychiatrist? And then what is their specialty? Do they work with people? Do they have training in trauma or anxiety or depression or impulse control problems or addiction or gambling issues or family therapy, couples therapy, right? So you want to be able to ask what their specialty is. Are you part of a special population that you want to make sure that a person can work with? Are you an immigrant? Are you someone who's gone through are you a refugee? You've gone through having to flee your country for political or conflict or other reasons? Are you from a certain ethnic or racial group? A lot now, there's a big push to get, to say that therapy is not just for the mainstream. It's not just for white folks. It's for all kind of people. Are you looking for a Spanish-speaking therapist? Are you looking for someone of a certain racial or ethnic background? Are you looking for a Black therapist? Are you looking for a female therapist, a Black female therapist, a Black male therapist? Are you looking for someone who speaks Chinese? Are you looking for a Muslim therapist? So there are all kind of aspects of not only the therapist's what their particular field in mental health is or what their specialty is, but also who they are as a person. And that is important to some people. And so you have a right to find out and to find out sort of who your therapist is. And this is not on a personal level. I'm talking more professional in their background. One thing you'll find about the therapy relationship, and that's part of doing your homework and research, is that it's not a personal relationship. It's not a friendship. So your therapist is not likely to, tell you what they did last weekend and give you all their kids' names and, who their spouse is, right? It's not about the therapist. It's about working on you and your issues and helping through this collaboration with someone that has the skills and the demeanor and the temperament to really help you work through what you're going through. That's the process, right? Also, you want to make sure that the person you're seeing is licensed. And I also want to bring up this idea of of coaching. So now you have a lot of people who are coaches, which is great. I actually implement coaching into one of the services that CHAD offers. But you want to make sure that what you're going to, so if you're looking for a business coach to help you launch your business, or you're looking for a life coach or a weight loss coach to help you work on a specific goal that you're trying to achieve in the future, that's fine. But if you know you're trying to work through some deeper emotional and psychological cognitive, learning issues that require a certain skill set, you want to make sure that the person is credentialed for that. So someone could be a certified coach, but it doesn't mean that they're a licensed mental health professional. And so, like I said, you want to also find out if the person you're seeing is licensed. If they are not independently licensed, they should be working under the license of someone else, and you should know who that person is. Okay, so you have a right. Licensure there is for a purpose, to protect the public. There are certain minimal standards that any licensed professional has to meet, and ongoing continuing education so that they are keeping themselves up to date with the newest approaches and theories and understanding about your particular problem. Okay, so you want to understand, number one, that this is a huge step that you're taking. Number two, start to do your homework, your research, ask around, look on the internet, ask your physician. Number three, you want to start to look at the profiles of people that you're interested in working with. You are allowed to ask questions. The therapy process should be collaborative. Using your participation in it, as well as the therapist's skills, expertise, and knowledge. And then finally, you want to understand that therapy is a process. It's not a one-time thing. It's not a quick fix. It's a process that helps you to uncover, and depending on what you're working on, right? So there are all kind of approaches to therapy. There's more exploratory, helping you to develop insights and better understand things. There's very hands-on behavioral approaches that help you sort of try to change a particular behavior or thought pattern, more cognitive or more behavioral, very structured. And then there's stuff in between, right? So depending, and that's something that you can discuss with your potential therapist. What are their approaches? What are their methods? And how do they tend to work? Okay, so it's a huge step. Do your research and do your homework. Look into the profiles and skills and licensure of the person that you want to work with, and understand that it is a process. It's a process that for many people brings about enormous growth and benefit in terms of a sense of psychological and emotional freedom, relief and release from certain almost what you might call mental prisons that we might have been stuck in, or patterns, forming the capacity to form new patterns and habits, and look to have a different future than the past that you might have felt has held you back. Okay, so let me know if you have any questions, if you have any particular Oh, also, last thing I wanted to say is that there are different modalities and approaches, right? So there's individual therapy, there is medication that might be used as part of it. There's different types of group therapy where other people that have similar issues that can be very powerful to help you know that you're not alone, and it's led by one or two group leaders. There's homework, there's out of session activities that you might do. So there are all kind of approaches. And also, I wanted to let you know some of the things that the Center for Healing and Development, CHAD, has in store. This spring, we launched our journaling group, which is coming to a close and has been very good. And in the summer, we are going to be launching some more groups: everyday mindfulness, healing from trauma, and post-divorce support groups. So those are 3 groups to look out for. We are also going to be starting our online coaching master group that is going to be only open to a small number of people. And so you'll be seeing more information about that to help you overcome fear, self-doubt, and to move forward to reach the goals that you want to reach. So let me know if you have any questions about therapy, what your experience has been, and if you want more information about the Center for Healing and Development, you can find us on our Facebook page, Chad Wellness. You can find us online, www.chadwellness.com. That's ChadWellness.com, and you can find out all about our services and what we have to offer to individuals, the community, and organizations. Thank you so much for tuning in. Have a wonderful day, and I encourage you, if you are thinking about therapy, go for it, do it. It's a wonderful resource that can be really helpful to you. Okay? Take care.